one of the key corollaries of the pandemic is anxiety. One of
Mm.
the most important aspects of coming to the dentist or not is also anxiety. So the combination of anxiety from patients with regard to seeking care is something that has been really a focus of a lot of attention with regard to patients today. I mean, I have patients
Right.
that come to my office who have not left their house since the pandemic started.
Wow. I mean, I was going to ask about safety precautions, and you also have to deal with heightened levels of anxiety. So, how do you deal with that, and what other safety precautions have you taken at the office?
Well, regulatory affairs across Canada have been very good in trying to make sure that safety is a priority. It's we in most dental offices, PPE is a requirement, filtration is a requirement. So patients should feel safe. I mean, the dental environment has always been a very, very safe environment. We are no strangers to sterilization. We are no strangers uh, to any of these aspects that are patient protective. One of the things that has really changed in the last little while, because of the inability of patients to receive care, is consultation and the ability to connect with dentists online. And I know
Hmm.
for myself, I'm part of a group of 250 dentists across Canada that started a way where patients can consult and lessen their anxiety through an application called Dentistry Online. One of the things that patients need is to be able to contact a dentist when things occur. You have a chipped tooth, you have pain, and sometimes you can't even make it into the office. Sometimes it's because of the pandemic. Sometimes it could be you're in a home, you're vulnerable. Sometimes it's because of fear. And to lower that anxiety, the idea to be able to speak to a dentist when you have a problem is crucial.
Well, it's interesting to hear that because we have spoken about telemedicine here on the show, and certainly many people recently have only seen their doctors that way. So it's interesting to hear that it's also happening in dentistry. Having said that, do you think people should delay routine, non essential oral health care at the moment?
Absolutely not. There is absolutely no danger to dental care. Uh, Patients normally, and again, it depends in which province you're at, but in general, when you walk into the office, temperatures are taken, proper PPE with regard to the conditions of the patients are looked at, and as I said, sterilization goes forward. Uh, there's very little risk in going to the dentist. There is a risk in ignoring issues. I mean, I had an elderly lady in my office yesterday who broke a filling, and because of circumstances, fear, and the fact that she was not sure whether she would be able to leave her residence and come to the dentist, when she finally showed up yesterday, we're taking out the tooth. I mean, that's
Yeah,
quite sad. So I mean,
yeah,
problems don't go away, and ignoring them only makes things worse. Teeth don't fix themselves. So I think
yeah.
people should be very secure with regard to seeing their dentist.
Well, Dr. Dolman, before we let you go, you were presented with a prestigious award by Israel Bonds and the Alpha Omega International Dental Society for your contributions to the field of dentistry. So we want to take a moment to congratulate you for, using your innovative approach to dentistry and to keep business going during these challenging times. So congratulations.
Thank you so much. It was all basically to try to raise funds for oral pathology. Oral pathology and oral cancer are very important. Another reason to make sure that you visit your dentist regularly.